The goal with pulmonary patients who have chronic disease is to give them the best quality of life that they can possibly have. And I get to help them through the fear and through the confusion and through the anxiety, because that's just as important as through the medical care. I was on a path towards medicine since I'm a kid, and I said, okay, I'm going to drive an ambulance. And I never got to drive because I ran out of time and I got into medical school. But that excitement of actually being involved in the patient's care and making a difference to them, it made it more meaningful, and it made me feel that I'm on the right path. Here at the Memorial Sleep Center, we see patients with multiple sleep diagnoses. The most common one, unequivocally, is the obstructive sleep apnea syndrome, or as people call it, sleep apnea. The most common symptom is that of sleepiness during the day. And not every person realizes that their sleepiness is because of poor sleep, because in their minds, they slept reasonably well for 6 or 7 or 8 hours during the night. But what they don't understand is that the quality of their sleep was terrible, and it was fragmented in a way that they're unaware of because they were sleeping. There's a large array of pulmonary diagnoses that we see in the office on a day-to-day basis. When I was in training, people with certain levels of COPD, they told us they would not be alive in a year. People now wear oxygen, and the equipment is much smaller and lighter. 25 years ago, they weren't doing that. If they were stuck with oxygen, they were stuck at home. Pulmonologists work in the ICU, so on one hand, I get the adrenaline of the ICU. On the other hand, I have an office, and I get to sit in my office, speak to my patients, get to know them. I get to take care of them over time. I get to help them through the good times. I get to help them through the bad times. I love that they feel comfortable coming to my office and looking at me and saying, Dr. Gittler, you put on a few pounds. I'm very happy with the choice that I picked. I can't imagine doing anything different. It's very fulfilling.